I'm Dr. B. Surendra, consultant medical oncologist at Omega Hospitals, Gachibowli and Banjara Hills, Hyderabad. Today I'll be talking on India and oral cancers or head and neck cancers. Head and neck cancer includes cancers on the lip, inner surface of the cheek, lateral border of the tongue, posterior surface of the tongue, hard palate, soft palate, or the sulcus or the gap between the gums and the cheek. Most of the time, when we come across these malignancies, we ignore due to lack of knowledge or awareness about these presentations, that is a persistent non-healing ulcer. India happens to be the global capital for head and neck cancer with very high incidence of head and neck cancers in our country. Close to 30% of the world's total head and neck cancer burden is seen in India alone. That's why India is labeled as global capital for head and neck cancers. Unfortunately, majority of the patients present to our clinics with an advanced stage disease, and this advanced stage presentation could be due to lack of knowledge or awareness among the people regarding the risk factors and the manifestations or the warning signs of these particular disease. And ultimately, when we come across with advanced stage disease, in spite of the best treatment, the outcome remains unsatisfactory. The common risk factors for head and neck cancers include chewing of tobacco in different forms like cheaply available tobacco products, what we come across as gutka, kaini, betel nuts. Apart from chewing of tobacco, other common risk factors which enhance or promote the risk of developing oral cancers include smoking, consumption of alcohol, poor oral hygiene, ill-fitting dentures, a sharp tooth. These are important risk factors which needs to be given importance and avoided in order to reduce deaths due to oral cancers. When it comes to signs and symptoms like any other malignancy or any other disease, even oral cancers do present to us with warning signs. It is only when we do not give importance to these warning signs we end up developing an advanced stage malignancy. The common signs what the patients with oral pharyngeal cancers come across are again white patches or red patches on the inner surface of the cheek or the surface of the tongue, what we call them as leukoplakic patches or erythroplakic patches. Apart from these patches, there will be a presentation like persistent, painless, non-healing ulcers on the surface of the lips, gums, lateral borders of the tongue or inner surface of the cheek. Apart from these non-healing ulcers, the other common signs include incomplete opening of the mouth, what we call as trismus. There will be incomplete opening of the mouth and pain on swallowing, intolerance to spice or oral mucositis. Even with little uneasiness, the people will end up with loss of taste, ultimately leading to loss of appetite and loss of weight. So these are some of the common signs and symptoms which are again very important to be given importance and get them evaluated in order to diagnose and get rid of the disease at an early stage. So there is a need for us to get regular health checkups, and when it comes to treatment of oropharyngeal cancers, in early stage disease, only surgery alone can be sufficient. But when it becomes a locoregional disease, that is with lymph nodes in the neck, lesion in the tongue or surface or oral surface of the tongue or cheeks or lips, then there is a need for combination therapy, that is surgery followed by chemotherapy along with the radiation therapy. But when it becomes an advanced stage disease, only chemotherapy along with radiation is the only treatment option. But these days, with advances in diagnostics and treatments, there is a lot of other treatment modalities which have come into existence, like targeted therapies, which can be of some help in controlling the disease process. When diagnosed at an early stage with less treatment, less cost, less pain, we can regain a near normal life. But when it becomes an advanced stage disease, in spite of best treatment, the outcome remains unsatisfactory. Thank you.